Soon as we get back online, I hope it's in.
I don't know, Brian. We should be up, I think.
Hey, while we're waiting, I'm still looking for some budgets from Castile, Warsaw, Sheldon.
Thank you, we'll pass the message on.
And don't forget to send one with a raised seal, she'll send you back.
There's a booby prize for the last one.
Bye-bye.
Okay, can I have a motion for number 11? Thank you. Supervisor Roberts. Any further discussion? All in favor? Aye.
Last item is permission to amend salary schedule.
You want to pay?
This is what Nazar that I was originally, I've been covering the assistant director for adult services position since Kristen left in September. The plan originally was for it to be go through CCSI, but they didn't like that. So we're now back to this is to pay me for that time. What the proposal was to take the amount of time that was covering the position, time I've been working at least 5 hours a week to cover that. And that's and taking her rate of where she was at. That's how it gets to that $2,360. I am so thankful to share that Kristen is coming back to her position. So she's going to be starting January 3rd. They're moving back to the community, mainly for school purposes, but so she will be back and resuming that position. So, but it's been good. It's always good to see what other people do within your department. So there's learning. But so this is permission for that. Yes, there's questions. And the funding is there because it was state aid that was going to CCSI, but the fiscal officer held it back because that piece of the contract wasn't filled. So state aid money that's there just need to be budgeted or shifted in the budget.
Motion by Supervisor Grant. Any further discussion? All in favor? Opposed?
Aye.
Anybody have anything else?
I just wanted to share, we are planning to do the Christmas tree in the rotunda because we weren't sure for the memory tree for suicide prevention because we weren't sure what was happening with construction down there.
We can move it to another part of the building.
So that is an option. We haven't really, I have been, Kristen did the suicide prevention stuff, so that wasn't on the agenda, but we have the ability to still do it. Is there an idea of where?
I think we could find out where, if you were interested in still doing it. We can get what Kristen in mind, but I think that.
Okay, because I think we had, Domes usually donates the trees, so I think they would still do that, but we weren't sure where.
We can make that happen.
Okay, so we will work on that. So, and the only other thing just for you guys to know it, we just had a training on Monday with law enforcement and Spectrum that we're doing a pilot project. It's called Mobile Access Program, where our crisis team people will have iPads, as will law enforcement. And when they're out on scene and they have somebody that's experiencing a mental health issue, the officer can request the counselor to call, and the person, the individual in crisis, can have a face-to-face on the iPad with the counselor. So the expected rollout start of that is December 15th. But iPads and trainings happen on Monday. It's just a matter of getting all the paperwork in place. But the Spectrum training their counselors. So all of the PDs have a couple iPads, and then the sheriff's department has 3 of them. So
Is that part of a grant? I think.
it is a grant through Office of Mental Health.
Good.
So it wasn't anything that involved us because it was between Spectrum and the police departments. So.
Anything else? Okay.
Thank you very much.
All right. Public forum. All right, so nice to see you here in person.
So glad to see everyone. Jerry, happy belated birthday. You're certainly welcome. I am truly glad to be back. And before we start, I'd like to acknowledge my colleagues at the health department for covering our wide array of business in my absence. I'm so glad to be back.
Okay. First couple items are first. Oh, I'm so, go ahead.
Sure. I guess also not in the agenda, I'd like to acknowledge the contributions of Kim Standish to our department over the last nearly 4 years. You are leaving us better than you found us, and I'm very grateful for the work that you've done. Seated next to Kim is Jessica Merrill, our newly soon-to-be appointed fiscal administrator. Congratulations to Jess, who came to us a number of years ago from social services and has really dropped in and gotten the job done, and I'm so proud to have her as part of this team.
Very good. Okay. Item 1. Guys.
So the COVID response specialist per diems are vaccinators. And this is a little COVID backstory. Just recently, Governor Hochul has renewed the state of emergency in New York. But during a period of time when there was a lapse in that, it really precluded the department from using volunteers without some side liability issues. So these folks are vaccinators. It is per diem covered by a grant. One of them was signed by HR Chairwoman Ryan a month ago. Because booster business is big. And so without having volunteer vaccinators in the mix, we're vaccinating out of the health department. So it's become a different scale of an operation. So one of these has been built. The other 2 we need sooner rather than later. I'm not certain the success that we'll have recruiting medical professionals. It is a time of great shortage. However, we have opened it up to LPNs, which may make it attractive on that side. So that's item 1. Number 2 is related to the permission to fill the fiscal administrator. This is setting the salary at $50,000 annually with eligibility for an additional $2,000 upon permanent appointment, and that would be following civil service examination and with meeting certain pre-established guidelines. Fiscal officer, public health. We'd like to get that posted. This is permission to fill the salary range for that position after taking a look across the county and other departments and internally to the health department. That salary range will be between 40 and 45,000. But that's the request pending the credentials and experience of the successful candidate. And the last one is Water resource specialist temporary. That position was approved earlier this year and was actually a split between the water resource agency and the health department for the services of Steve Perkins on a roll down basis, providing training to some of our less senior technical staff in environmental and also continuing working on the objectives for the resource agency. So that position was temporary through 12/31. And this is some changes to the scope of the position, removing the health department responsibility. Rob, it's all you. And realigning the position for the water resource agency specifically. So that's that request.
We'll go all through the resource. So to move on, okay.
Okay.
Any questions on any of those? Okay. What we read back?
So I meant to ask you about this while you were on vacation. So Dr. Collins, in addition to functioning as Commissioner of Health and so much more for our community, also serves as the medical director for the health department.
Yeah, I have a motion by Supervisor Becker. Any discussion? Hearing none, all in favor?
Aye.
Aye. Congratulations. All right, next up is the reappointment.
So the regulatory advisory board is the Board of Health for the health department, and the appointments are on a 6-year rolling term with the supervisor member expiring each year, and then one other member. Dr. Abbasi's term is expiring at the end of this year, and he has expressed willingness to continue serving on the Board of Health.
Motion. Thank you, Supervisor Roberts. All in favor? Aye. Opposed? Carried. Next up is a transfer from family planning.
So the family planning clinic is on Town. If you'll recall, we've been mentioning for the last couple of meetings that the funding that is the basis for that clinic runs out at the end of this year. And so we have 3 employees, and we've been supporting them to take steps to find employment elsewhere in the county. All 3 of them are valued contributors and colleagues. One of the employees accepted a position at the health system, and the health system very graciously is loaning her back to us during the period of spent lying down in family planning. This MOU is to pay the hospital back for the hours that this employee works in the health department for the duration of lying down.
Okay. Supervisor Brick. Further discussion? All in favor?
Aye.
Opposed? And transfer to the coroners.
I actually don't know the backstory on this one. Kim, is this just housekeeping?
Yeah, it's just, it had to come to committee because the money came out of 8.4 into a 0.8. I don't know what we're gonna call that.
It's the same thing, yeah.
But, yeah, it's $362, and there was just adjustments, retirement rate was adjusted, and there was no approach in it.
Okay. I have a motion by Supervisor Groves. Any discussion? Hearing none. All in favor?
Aye.
Opposed? Carried. Okay, now we got bookkeeping.
So this is a contract for 2022 with Intuitive Bookkeeping. Kim Standish happens to be the principal of Intuitive Bookkeeping. Kim has expressed willingness. Let me back up a little bit. A lot of the unique fiscal functions associated with the health department are things that only happen once a year. A good example of that would be the preparation of the annual state aid application, the preparation of the county budget, the annual cost report that's required. And so, despite the fact that there is an overlap in time between Kim and Jess, and the training is happening right now in real time, there are items that we will need some support for in 2022. And so I consulted with HR about the best way to accomplish this, whether it would be fiscal administrator per diem, or, and this was a Kim's suggestion, a contract with her bookkeeping business. And after working with HR on the test of contract versus employee, they supported the contract for the period of 2022. And so the funds will be found. And this is, I find it unlikely that Jess will require this amount of, that much support throughout the course of the year. Part of the reason this is very essential is Jess's promotion to fiscal administrator is leaving us a vacancy of fiscal officer. And so, although budget and Janice particularly have been remarkable in their support of the health department. Quite a bit has changed in the last 4 years. So this contract is to provide training and education, not to do the work, but to train and educate our fiscal team during 2022.
Question? Motion by Supervisor Brick. All in favor?
Aye.
Aye.
Carried. Water operator training.
So Charlie, I think that I brought up the attachment announcing the water operators training. This is coming up in December, and if you'll recall, this is for municipalities that have water systems. The operators are required to have a certain number of CEUs on a rolling basis in order to keep your certification. So we hold this annually. The format will be quite a bit like it was last year, where we're really limiting attendance. Wyoming County operators are doing progress. There is space and capacity will allow registration from out of county neighbors. But this is important for the water operators to maintain their certification. So it's a periodical, with big facility, the jail will do the meals, and all of the expenses come out of the drinking water enhancement grant.
You wanted that on the board packet, right? That's why. But
So I don't know if that's particularly of interest to the public, but certainly it's.
This is only for current operators, certification for new operator.
Yes, it's for our operators.
I'm looking for an operator.
Okay. At one point, there was kind of a discussion of having an operator for traveling operator. Ever,
that hasn't come to fruition yet. I know that was something Steve was working on in the Water Resource Agency. And we could certainly speak better to that. I'm not sure. I know that was a proposal.
I think he's still,
I know that.
they're far and few between.
Yeah.
We're having trouble finding one for my small district, so.
back in May, I had the guy that's been doing a phenomenal job for maybe about 4 years, just a resident in the middle of the night, there was some sort of leak, and he even helped fire the police out, and so they said, go wake my water operator up at 1:30 in the morning for this minor leak, and so the next day he's tendered his resignation, put us into his family. So again, if there was something.
I think it's a good question for the water resources. See where they're at.
Jacob has a longtime operator that has done a great job. But it's always, if he gets to retirement time, then again, everybody seems to have the same problem. So
I'm very fortunate to have two close by.
Yeah.
So.
Someone.
yeah, and I've asked them if they wanted to take on additional.
I just texted him to see if he was gonna go to the meeting.
Okay. So that's an FYI. Okay, number 11, family planning write-off.
So normally the write-offs, these are balances deemed uncollectible for family planning, medical care. I would point out that the 2018 write-off is significantly larger than we normally feel comfortable bringing. That was during the period of time that we were contracting with Integra Billing Services. And retrospectively, that ended up being appropriate for the moment, but it was a very slow launch. And Kim did a good job managing them into attentiveness, but as our knowledge internally increased, our need and justification for paying the work decreased, and we ended up terminating the contract. So the larger than expected write-off for 2018 is during a period of time when Integral was on board. Is that right?
They started in July of 2018.
It appears that they were very good at dealing with insurance claims, but when it came to Medicaid and family planning program, they weren't listening to our training and our recommendations, and a lot of the claims just could not, but they weren't going through properly, so they were being rejected, and we finally caught on to that. Corrected that part.
And I will mention that despite the 2018 figure, the total write-off across the 2 years is 2.6% of receivables. Is that correct?
Could I see a motion? Any further discussion? All in favor?
Aye.
Okay. FYI.
Two. So the first one is with the health system. That's that employment piece to cover the transfer earlier in the meeting. It looks like that expense, although the agreement was not to exceed 2,000, it appears the expense will be something right around a little less than $1,000. So those are partner items. And the second one is the Warsaw Penny Saver for printing and insert for full distribution to the Penny Saver circulation. That is paid in full by the Navigator program to promote open enrollment to the marketplace. And Cheryl, I think you have an attachment on that one. That would be a good one to go in the board packet if that's okay.
Okay. We have updates. Departmental updates.
So the staffing update, I essentially covered. We already have some positions that are pending posting with HR for the COVID response specialist per diem. And also we're moving along the path with the fellows program. If you recall, this is a new grant program. State Health is funding local health departments to hire individuals to improve public health infrastructure. So we now have our GIS candidate with the start date of December 13th. And I've been interacting with planning just to make sure that that department is ready to receive Joanna. And we're looking forward to getting her started. It's a big lift, and I have a great deal of confidence that she's going to get it moving. So there'll be some additional positions associated with the fellows program. They've all been approved. One is the coordinator, which the state tells us we must have, and then 2 other fellows that will be working on projects that are yet to be identified. So we'll bring updates back as those people are onboarded. We're also having a little space crisis at the health department, so we need to find a spot for those folks. And thank you to the planning committee and friends that came around for a visit and look at stuff. Staffing update beyond that. We're busy. Is the very shortest story. And I'll roll into the COVID update if that's okay. So CDC has now changed the recommendation that everyone who has been fully vaccinated, 18 and older, now receive a booster shot. 6 months after your second dose for Pfizer and Moderna, 2 months for J&J. So we've seen in the pediatric doses, the 5 to 11 and 12 to 17, we're making the rounds of the schools and providing pediatric vaccines to any parents that are interested in having their children vaccinated. We're starting out second doses for those kiddos inside the school districts, I think, this week. We've also hosted a couple of Saturday events in the health department for the pediatric population, recognizing that you need to have parents with the kiddos, and having that happen on a school night is tricky business. So we're rolling Saturdays right now as well. The biggest demand right now is for the booster shots. So we, case in point, we had, I think, 40 opened up for tomorrow, added another 60 yesterday. So tomorrow we're gonna be vaccinating out of the front of the building and testing out of the back. And so we're seeing fair demand on the booster shots, so. Okay. Are there any questions on that? At this point, vaccinating has become a very cautious undertaking because you have initial dose vaccination, you have booster at a different dose, you have pediatric at a different dose, 11 to 17, and so it's become a very, the array is wide of vaccines that we're offering right now. Well, so transferring vaccine, for example, to the health system to make sure that the nursing home residents and their staff have vaccine on site if they need, although I think the nursing facility has been taken care of by the outside pharmacy. Yeah. So, onward. I feel like I need new material. Onward. Most of the strain that's circulating right now appears to be Delta variant. You may have heard on the news some early discussion about a new variant that's appeared or thought originally to have been discovered in South Africa. More recently, I heard this morning that it may be a variant circulating in Europe, a couple of cases in Ontario. I don't think there's any hard science behind the questions that we may have regarding the new variant, the severity, the transmissibility, the effectiveness of the vaccine. I think that will become clear soon. Is that correct?
Can they tell which variant it is by the testing?
Not for the testing that we're doing in-house. It has to be a test, a sample that's collected and sent out to a lab. And I don't think all labs are able to run the variant strains. I know Wadsworth does.
Yeah, I mean, it wouldn't be an option for us to request it. It's something that the state does as part of their ongoing monitoring of situations, so, yeah.
Like, and get a COVID test for procedure she's going to have, since that new facility in Geneseo, she had a sick.
I've heard about that. So that is not, this is a good time to talk a little bit about testing is, I don't know if any of y'all watched the news this morning, but we are hearing that Monroe County, Fellow has now made the decision, no community-wide mandates, but they reinstated the state of emergency, and they have mandated that any visitors and employees in county buildings be masked. And there appears to be widespread distribution of test kits, which caused me to go, what? While I was driving here in the car this morning, because we're having difficulty getting test kits. The Binax cards are nowhere to be found. We thought we had an avenue for the quick view testing, which is a similar antigen rapid test. That does not appear to be available to us. So I think the balance of today, Supervisor Brick, I'm gonna start learning about other options and maybe more invest that comes around here, because I think at this point, the very best thing that we can do for the community is anyone who's symptomatic, urge them to get a test so they know their status, so they can make the right choice. So,
Is it all just here, anymore?
yes, they do. But it's interesting, so we're running the wood stove in the house, and I have the beloved dust that is my friend from October to March. And so I'm sneezing, and I was like, and so, I think we've all become a little alarmed by symptoms that we're used to having because these are strange times, so.
We have a new test, you know, the ESS, if you can't smell the smell they got down.
So our cases in the community are high. I think we had about 150 active cases yesterday. Our percentage, both prior day and 7-day rolling average has been running high. We had a bell ringing 18.1% positivity a couple of days ago, which is terrifying. Bear in mind, we are a small sample size, there's not a lot of testing that's going on in this county, so yes, any positive cases are certainly concerning, but a rate like that gets attention that we don't want. The daily calls with the health system around staffing are continuing. The health department and emergency services are now participating in those calls as well. The hospital has a lot of COVID patients, and there's some very heroic work happening there. It's different than it was this time last year when they were talking about how to expand census to 50% of OPSERT levels, and now they're trying to provide care for patients and make sure staffing ratios are maintained.
That was a question that was asked to me, Mr. Joe, about the surge plan we had last year. Well, the surge plan is great, but we have no staff to implement the surge plan at this point. Like a year ago, we had staff and do it. It's not as much a space issue right now as it is, it's a bottom line staff. There's no capacity to expand without additional staff. And the health system is working very hard to try and work through that, but it's a national issue and certainly a regional issue as well.
And so I would say also that's, it's not uncommon to some of the larger health systems in the area, Rochester Regional and Strong. Both are ships with a lot of, tentacles, and they're retracting in order to provide critical care inside the facilities. And so, they have a lot more staff at their disposal to reassign in order to make sure there's care for the most critically ill patients. But if we took a look at doing that, you're then dealing with community care and people's access to their primary care providers, which doesn't really create any capacity in the ER, right? So it's a complicated landscape right now. And we'll be talking in a little more detail at 11 o'clock today on how we can support the health system during this period of time. That's enough COVID. Does anyone have any questions?
Do you know, is the hospital still on delay?
I don't know about
They
this.
were last night.
Yeah.
I don't know about this morning.
I'm glad,
So delay is a step down from diversion. I think it's a descriptive that simply says,
Just
plan on
waiting,
waiting.
that's up, we're gonna be waiting a while. Again, most of that is due to the patients that are admitted that they don't have beds for upstairs and they're sitting in the emergency room. So, for example, we have, yesterday we had 10 beds, well, actually 14 beds in the emergency room, and 6 or 7 of those have patients that have been admitted, they're sitting there. So we don't have no capacity to put anybody that comes in anywhere. People keep coming in the hallways and also it's just this backup that rapidly accelerates. And diversion works, gives you a couple of hours to keep your pricing and things going, but unfortunately diversion, from a regional perspective, ultimately is kicking the can down the road. Because then you've got, Tavia and Gainesville, Springville, and all of them getting filled up. So it ends up, it works for a short while, but ultimately ends up bogging down the entire system very quickly.
And then there's the impact to the EMS transport agencies as well, because we're hearing wait times in other health systems in other emergency rooms are just as significant.
I think that's right. Rochester Hospital stuff. Few months. That's there for.
and
Staff up.
this is just, so say if I get COVID and I'm really not that bad or anything, what do they prescribe for people that just basically stay home, self-quarantine, do a vaporizer, cold medicine? I mean,
Basically just supportive care. I mean, there's some vitamin recommendations, vitamin C, vitamin D, zinc, some things that you can find out there and shown to have some efficacy in shortening or decreasing symptoms.
yeah,
Primarily symptom based. The big thing, we're looking for that people that have COVID is their oxygen levels. And if it's saying you're short of breath and their oxygen saturation is dropping, then you need to come in. That's typically, you tell people to go to the Walmart or wherever, get one of your typical sex centers and just keep running yourself at home. Then we see how it goes. And then the other, so the same thing, pneumonia and the low oxygen levels. And for the older folks, we're seeing a lot of them come in, not so much low oxygen levels, but just super debilitated, dehydrated. And once they get to that point, they really just can't function. Many of them just for that reason.
So make sure you keep your electrolytes up and,
Sports drinks, skating, that kind of thing. Then watch your breathing and respiratory status.
I don't know, I'm just thinking, maybe that would help the community to kind of push that out there that, get your zinc, get your vitamin D, get your vitamin C, to help fight off that, because if you're getting it, once you get it, there's really nothing you can do about it other than
So,
prevent.
yes, and I'll make note of that because that may be a community education piece that we might write. So at this point, I will take that suggestion back to the house. The other thing is coming soonish to a community pharmacy near us. If you get influenza, early in your symptom development, 3 days, I think you can take Tamiflu, and Tamiflu shortens the duration and can shorten the duration and severity of symptoms. Merck, I think, is apparently developing and has submitted to the FDA for approval for an antiviral for COVID. So we reached out to our pharmacy partners, Sinclair's and Attica Pharmacy, both of whom have expressed willingness in being part of the rollout there. So thank you to them. Both of those pharmacies have been remarkable in supporting the response here. So I don't have a timeline on that. I think it's due to be supported or presented to FDA this month sometime. More to come.
So the shelves will be bare, vitamin C, zinc.
Stock up.
Okay, run on it. I'm not sure.
Okay. Board of Health meeting is December 15th. That will be a Zoom meeting. Jerry City. I'm going to skip over the environmental aspects and cover family planning and wrapping up. So family planning is winding down. I mentioned that December 31st is the end of the current grant cycle. We are not seeing patients beyond December 16th in order to allow time for labs and follow-up care to come in. So that's in process. Each of the 3 employees that are employees of the family planning clinic have found employment elsewhere. Tina Sandham has taken the COVID response specialist position inside the health department, so she'll be staying on with us. And the Pamela, who has been a remarkable support person and beloved by the clients, has taken a job at the health system and will continue some per diem work at the health department to help us wrap up billing and things. And Lisa Kemp, who worked for us per diem as a nurse practitioner, has also accepted a new opportunity with the health system. So thank you to each of those 3 staff members for their long and dedicated service to our clients. We have lots of stuff in the family planning clinic, and a lot of it is equipment. So there are exam tables, there are supplies, pharmaceuticals, and masks, gowns, gloves. My intention was to reach out to the health system based on their large clinical presence and see if they had interest in allowing us to transfer. Each of those items is fully depreciated, I think, except for the copier, there's a teeny little bit left on it. I don't know that we would receive as much on a sealed bid as it might cost the health system to invest in those supplies. So I just wanted to touch base with the group and see, what's your pleasure.
I would say those supplies were bought to facilitate the health needs of this community. Now, granted, it is a different health need, but if they can serve the community at the hospital, that certainly makes more sense.
So I appreciate that. Those were my thoughts as well. They were purchased with dollars from the family planning clinic, whether it was grant or receivable. So I'd like to work with the health system and see if they, what they can use, and then we'll return with an actual, and some of it will be potentially redeployed inside the health department as well. We got clinical needs as well, so. But if it's okay with the group, I'll start that conversation with the hospital and bring the list back when it's short of things that we truly don't need.
Do you need a motion on that for like surplus equipment?
We'll bring the list back once we get a little further down the line. And then the last one is the Article 28 space. This is the clinical space used by the family planning program right now. We are having internal discussions on use of that space for the health department. We're not quite there yet. The health department has a statutory responsibility to do STD testing and treatment at no cost. And we have a couple of options on how to handle that. It might be contracting with another provider. It might be providing it directly on an extremely limited basis as part of the staff we already have. We're still working through that right now. But it may be that the clinic space family planning is using might be useful to the health department for those reasons. So we'll come back with it.
Anything else for Laura? Don't escape my thought.
First off, if there's any questions on the environmental health report or waste and measures reports for October. But I did want to come and let you know, we did perform compliance checks for our tobacco facilities last week. We did have 5 sales, which is concerning. We're working through our enforcement actions on that. One facility has actually already requested a hearing for that sale, so we'll be scheduling that. But again, just want to give an FYI that that did happen, and we're working through that. And if you get calls, we've got information, but yeah. Any questions on that? Okay. Okay. Oh, one other thing, as a result of that, we have scheduled a training course for our facilities to partake in. That is scheduled for the 5th of January. So if any of these facilities, any facility in the county would like to participate in that, we're working on offering that. So.
Could you just give a quick summary of what the program is and the points it's doing all that?
Sure. Yep. Absolutely. So it's the Adolescent Tobacco Use Prevention Act. Recently, the age was raised to 21. So the tobacco products are age restricted to 21 now. The program requires us to go do what we call compliance checks. We take a minor into the facility and observe them trying to make a purchase of tobacco products. Our inspector watches the entire event. If there is a sale, evidence is held. The enforcement actions are initiated. If the facilities are found in violation of Article 13F, there are 2 points administered on their license. If a facility has 3 points, they will lose their license to sell tobacco products for a year, and their license, if they carry one, to sell lottery products for 6 months. So it's a big deal. The training course I spoke of, if the clerk that sold has taken the training course and has valid certificate, they would only receive 1 point on the license. So that's the carrot we dangle for training people on proper ways to eliminate sales. So again, these 5 facilities, to my knowledge, none of them have produced a training certificate for the course, so likely would be 2 points on each of those licenses if the violation is upheld.
And if a violation is upheld, that increases the frequency of inspections going forward.
Correct. To 2 a year.
That's what I was going to ask.
Yes.
How often you only?
And so it was not your friendly neighborhood health department that it increased the age of purchase to 21, that was the New York State. Just to be clear.
And the place I was at this morning, I saw all alcohol and tobacco sales, no matter your age, will be approved. Which, again, I walked in and said, really, it looked like I'm undergoing one. Where I simply didn't have the license on me at the time.
Yeah, has there been any talk about, since it's gonna happen in a few of the villages, it looks like, for cannabis retail and, dispensary?
Right, we haven't heard about them adding that into the two program, but
I think it's coming.
I would say, yeah.
So I do think also coming up in December, it is municipalities' window to opt in or opt out or do nothing, correct? So it's been my intention to reach out to the municipalities just to understand what the landscape is in the county, just so we can just be aware. So. And that was a topic of a presentation at the New York State Association of Counties meeting. And
There's gonna be gummies available and you can, there's gonna be.
I have a spreadsheet who's opting in.
Can we share?
Any other questions for me?
So you have the kids going to try to buy cigarettes, do they try to buy chew or vape?
We typically have not, they can, so it's any tobacco product or vape product that is part of that tobacco.
Because I think kids would be more into vaping and.
Correct. We haven't typically asked for those products, but that is certainly potential.
I was seeing a huge increase in chew over cigarettes,
Yeah,
the tubes of chew.
Where are these kids getting their money?
Well, they were enterprising. They were becoming a retailer themselves.
Well, thank you.
buy the cheaper stuff.
Yes.
Okay.
Entrepreneurs.
Anything else to come before?
Jerry, would it be okay if I said something?
Absolutely.
So I just wanted to let everybody know, my resignation wasn't due to any unhappiness at the workplace or anything like that. I didn't want to be here. I'm moving over and working with a family business where we developed a strong need for some of my help. I found Wyoming County to be an amazing place to work, not only the county, but the health department. All you guys have been phenomenal from the first day, from the first meeting I attended. I felt welcome, I felt supported, and I'm looking forward to just moving into my position. Just got a lot of work to do. It's super busy, the department is busy, the people are amazing, and I hope that the fiscal officer comes in and do as good a job as you do. And I don't plan on being a stranger. My son's actually coming down here to do his road test in December. So. But thank you to everybody. I've really enjoyed my time in the county.
Thank you.
If there's nothing further to come before public health, I guess we're adjourned.
I got a couple.